Hi everyone, my name is Lara Yako. I am the cardiology director here at Insight Hospital. We just hosted our first cardiology event here at Insight, and we celebrated two of our patients who had coronary artery disease. We intervened using the Impella device, and we celebrated their outcome and how that impacted on their lifestyle.
Hi, my name is Andrew Dignan. I'm a clinical consultant for Abiomed. And at Abiomed, our goal is to recover hearts and save lives. And to be able to do that, we have one of our devices, the Impella CP. And this device actually lets the heart rest and relax. So in a patient that requires high-risk PCI or a patient that's in cardiogenic shock, this pump can get placed percutaneously through the leg and deliver 3.5 liters of flow from the ventricle itself, directly unloading the heart. And that allows us to have events like we had here today, where we have patients that come back and show us how much they've recovered, reconnect with their staff from the cath lab, from the emergency room, and from the ICU that have seen them at their worst, and now to see them again at their best.
My name is Elaine Lyles. I'm a patient of Dr. Singh in Insight Hospital. My heart problem started years ago because I smoked 2 packs of cigarettes a day. And I have high blood pressure, high cholesterol, those things. But it started years ago, and it just got worse and worse because I started doing other things. Before my procedure, I asked the Lord to take me because I was so miserable, in pain, couldn't breathe, that I had actually gave up. And my son didn't want to see me like this, so they brought me down here to Insight Hospital.
All right, my name is Dr. Surabjit Singh. I'm one of the interventional cardiologists here at Insight Hospital. I had the pleasure of taking care of Miss Lyles. So Miss Lyles presented to our hospital, to the emergency department actually with very significant trouble breathing. And when she presented to the hospital, the initial thought was it might be related to her lungs, as she has a history of COPD. So we actually wound up taking her to our cardiac catheterization laboratory. And when we did the angiogram, we found that she had multivessel disease, which was likely why her heart function was so reduced. So our options were basically to proceed with Impella-supported PCI, which is ultimately what we did. We optimized her medically over the next 2 to 3 weeks, putting her on all the medications that were deemed necessary. We also had her seen by our pulmonologist to make sure her lungs were in the best condition we can get them in.
You know, I was in one of the best hands doctors we have here in the United States. I know I was. You know what made it amazing too? I found out he was my anesthesiologist. And this is the first surgery I had. I had 4 surgeries. And I woke up in every last one of them. I didn't wake up on this one.
Right now, she is essentially asymptomatic. Her heart function has improved, although has not normalized. She's participating in cardiac rehab, and her functional capacity has dramatically improved from when we initially got to meet her.
After my procedure, I felt okay. You know, after the procedure, I was still in the hospital. In the first couple of days, it took me a little while to walk a distance. Because at first I could just only get to the bathroom, but I was able to go, before I left, I was able to go down the halls and mess with the nurses and all that.
Hello, I'm Edward Gardner. I'm a patient at Insight Hospital in the cardiac section. Actually, I didn't know I had a heart problem until I got to Insight. I could walk further than I used to. I didn't have any problem breathing. I wasn't falling down anymore.
My name is Dr. Diniotis. I'm one of the interventional cardiologists here at Insight Hospital. And today we're talking about Impella CP and high-risk PCIs, which in particular we're talking about one of our patients who was one of these many successful stories here at Insight Hospital. Mr. Gardner is the patient of ours that presented here at Insight Hospital with the chief complaint of right lower extremity discomfort. And upon further questioning, he had multiple episodes of exertional syncope, 12 episodes to be exact, as well as a history of some palpitations of chest pain. Well, the patient had a history of diabetes, hypertension, hyperlipidemia, as well as polyvascular disease, which entails both the renal arteries as well as the peripheral artery disease.
The experience I had with Dr. Bobby Diniotis is very good, right from the start. He was there every day. He checked on me. There were a lot of doctors coming to see me all day.
The patient was brought here back in Insight Hospital a few weeks later, where we implemented the Impella CP, which provided enough hemodynamic stability for us to deliver an effectively safe stent from the osteoleft main into the LAD. And since then, Mr. Gardner has been doing cardiac rehab. He's doing great. No further episodes of syncope. And I can say I'm really happy with the results.
After my procedure, the problems that I had of falling down and the distance I could walk, I didn't have anymore. I felt probably 100% better than when I came in.